Hi, my name is Seth Bechis. I'm an Associate Clinical Professor of Urology in San Diego, and today we're going to talk about performing bladder cancer surveillance using a single-use cystoscope from Ambu. Each year, over 80,000 Americans are diagnosed with bladder cancer. The good news is if caught early, mortality can be quite low. Once diagnosed, patients undergo surveillance cystoscopy every 3 to 6 months for several years. Today I will be performing a cystoscopy using the Ambu aScope 4 Cysto. Our hospital has adopted the aScope 4 Cysto for a variety of reasons. In the clinic setting, you don't require access to a sterile processor, which also frees up staff that otherwise would be spending time processing and turning over the scopes. Furthermore, it enables faster setup of the clinic room. We've been able to shorten our appointment times from a 1-hour procedure slot to only 15 minutes, therefore enabling us to see more patients and provide more procedures in a day. The digital tip and imaging I find to be comparable to any of the conventional scopes we currently use. The scope has 210 degrees of deflection. Because it's a single-use scope, you know that every time you open a new one, you'll have the same reliable deflection. So here we're passing the distal end of the scope in through the urethra. Here we're approaching the prostate. There's the verumontanum and the prostatic urethra. And now we pass the scope into the bladder where we can do surveillance. You can appreciate the general pink color of the bladder tissue, and areas where there's increased erythema or redness, the camera does a very good job of differentiating the two. You can appreciate some of the differences in the texture of the tissue as well. And here you can see as we survey around, there's an area of erythema or redness on the tissue, and the resolution is quite nice. And here the resolution, you can appreciate a foreign object. There's a hair here in the base of the bladder. And you can appreciate the prostate lobe, and here's the ureteral orifice where the ureter empties into the bladder. And you can see the level of detail and the resolution is quite good. Patients really appreciate having a scope that has not been used in another patient before them, especially right now during times when concerns about infection rates are higher. Overall, I've been very pleased with the Ambu aScope 4 Cysto. It's really enabled us to thrive and perform better services for our patients. Not only can we perform cystoscopy faster, the staff really enjoys working with it due to its ease. Patients are happy. The product is very easy to use and deploy and has benefits in sharing images and uploading them into the records. So overall, we've been very happy, and I look forward to working with Ambu as they have more technology developments down the road.